I'm Khalid Ali. I'm a senior lecturer in geriatrics at the Brighton Sussex Medical School. I'm a stroke consultant at Princess Royal Hospital, Hayward East. That's part of Brighton and Sussex University Hospitals Trust.
Hi, well, I'm Paul Seddon. I'm a respiratory paediatrician based at the Royal Alexandra Children's Hospital, which is just down the corridor here.
I'm Helga Dittmar. I'm from the University of Sussex.
Hi, I'm Matt Easterbrook. I'm from the University of Sussex. I'm a social psychologist.
Was there anything that you changed in your research as a result of input from the Jaffa panel?
Recent example is a study that I'm working on with colleagues on exploring the added benefits of carers of stroke survivors in a stroke rehabilitation unit, improving on physical outcomes for upper limb training. And sharing the initial draft or proposal, the research proposal with the lay member panel, I had lots of insight from, luckily one of the members in the panel is a stroke survivor herself, so we have very much an expert opinion, if I may say. Advice on the idea of the study in terms of methodology, how we should run the study, outcome measures. We have an intervention which, again, the lay member helped explore some of the issues that if we go to a funder, we were hoping to submit to a research for patient benefit scheme, that we might be questioned about why that particular intervention with that particular external agency, follow-up mechanisms, and as I said, outcome measures. So really in-depth insight and support into various aspects of the research proposal right at the early stage of designing and developing the study, the methodology, the intervention, the outcome measures, follow-up period, and so forth. So I have nothing but positive experience with the lay member research panel here at Brighton.
I discussed with the panel a project that we were submitting to do with trying to improve how often young people with asthma take their inhalers. And there were a number of things that the panel commented that made me think and go back and change things. So one of the things was to do with how we feed back information to young people about how often they're remembering to take their treatment. From the input that I got from the panel, it sounded as though it was going to be much better to do that by text messages rather than by a face-to-face or telephone call from a person, because there's less blame implied in it, and also because young people are more used to receiving messages by text. And the second thing that I changed, which I think was just as important, was about how often we feed back that information to young people. So originally we were planning to do it maybe once a month or once every couple of months, and the panel felt that it would be much more effective if we fed back that information more frequently. So once a week is what we've gone with.
We are developing research on whether a positive patient identity can help people adjust better to a physical health condition. The discussion has been really invaluable in two ways at least. One, identifying dimensions of identity that we have left out, which are really critical for people. And the second one, just being made aware of how patients might react or feel when they're filling the questionnaire and where to be careful.
So it's just given us a whole different perspective on our research. We've listened to people's criticism of what we were planning on doing, of the kind of questions we wanted to ask, and we've completely rewritten them as a consequence of the experiences people have been telling us about. So we've definitely improved our research because of it.
Was your research proposal successful or not?
So I have submitted the proposal to the mock panel, which have come back with more comments that I'm working through with my research collaborators, with the aim to submit to either the next cycle, which is in March 2015, or depending whether we get that in place for the next round, or defer to the one after. So I haven't got an outcome as yet, whether it be positive or successful or not. So not been submitted yet.
We've heard that it's got past the initial bit, but we won't know until November. There was another project that I discussed with the committee, with the panel, which was a different project to do with using a pulse oximeter to get breathing information in babies. And that actually already had been funded by the time I discussed it with the panel. But since then, we made some changes, and that's now been approved by the ethics committee, and we're actually collecting information on that already.